Hey Hattiesburg, it's Toby Barker. Thank you for joining us tonight for this briefing, which is, I realize, a little bit later than usual. Today we will go over today's numbers in terms of testing. We'll talk about this idea of where do we go from here, knowing that we've kind of seen some averages that have been consistent over the last 14 days. How do we go about reopening Hattiesburg? We'll talk about masks, and of course we'll do our regular act of courage. Today's numbers, again, these are system-wide for our healthcare organizations here in Hattiesburg. All of Forest General's 19 counties, all of Merit Health Wesley's 18, and of course, all of those counties that both served by Samurai and Hattiesburg Clinic. So far, we've had 5,444 total tests, again, system-wide in our healthcare organizations. 645 of those have come back positive. Of course, those are not all in Forest and Lamar counties. In fact, we're seeing much more kind of in the counties around Hattiesburg right now. 4,417 have come back negative. We have 383 pending as of now. Our two overall goals through all of the past 6 weeks, and our goals guiding us going forward, will be protecting vulnerable populations. Those are people over the age of 60. Those are folks with underlying health conditions. And then secondly, preventing overrun of the healthcare system by slowing the spread. When we talk about preventing overrun of the healthcare system, we talk about two real metrics: hospitalizations and ICU admissions. Right now, hospitalized in the Hattiesburg area, this is Merit Health and Forest General combined, we have 34. That's down slightly, down from under the average of the last 14 days, which is just over 36. We do have 2 patients under investigation right now who are showing symptoms, but we're still awaiting their tests. ICU admissions, some good news today. Even though we have 15 in the ICU, with the average over the last 14 days just 13.71. Merit Health Wesley actually has 0 patients in the ICU for the first time, I guess, since early when this started. So congratulations to Merit Health Wesley, and thanks to all of their great healthcare workers throughout this process, as well as Forest Generals. So the totals per county as of this morning: 207 in Forest County, 103 in Lamar County. That's 310 for the entire metro area. When we talk about kind of where the numbers are headed, we look at the 5-day average. The 5-day average takes a given day, the 2 days prior, the 2 days after, averages them all together. So the orange line is the 5-day average for Lamar County, which has really kind of been between 2 and 4, sometimes slightly above 4. Forest County's a little bit higher. It's going all the way to peaked around the April 14th, 15th, and 16th, and went down, then kind of went back up, and then back down again. And so what we're seeing, though, with the numbers is there's really no straight trajectory either up or down. It kind of fluctuates. Forest County has been between 4 and 8 in the 5-day average for 14 straight days. Even though there'll be days that we have 9 or days that we have 2, the 5-day average for the last 14 straight days has been between 4 and 8. Lamar County has been between 2 and 5 for the last 14 days. And so we have to ask ourselves now, is this the new normal? Is this what we should be expecting and hoping to sustain? Averaging around 33, 34, 35 hospitalizations and between 13 and 15 ICU admissions, where we consistently see in the metro area 6 to 13 new cases per day. While this seems like a new normal, we have to also keep in mind that we've lost 12 people in Forest County. 12 people have died because of COVID, and that's not something we should ever get used to. That should never be part of our hope of a new normal. Lamar County has lost 2 as well. But now, with factoring all that together and seeing some kind of trend over the last 14 days and kind of a window of where we've been with new positive cases, the question now is, where do we go from here? There are a couple facts that we need to think about when we talk about the path forward. Fact number 1 is COVID-19 will be with us until a vaccine or an effective treatment is found. And that could very well last 12 to 18 months or beyond, and that means the threat of COVID-19 will be with those vulnerable populations that we talk about. However, we think about it being with us until a vaccine or a treatment is found. We also have to go to fact number 2, which is we cannot stay in lockdown and shelter in place for that long. We know our economy can't handle it. I think our individual and collective mental health cannot handle it. Which means to fact number 3, we must prioritize public health, keeping in mind and trying to sustain our 2 goals: protecting vulnerable populations and preventing overrun of the healthcare system, while giving our economy the space to operate creatively. And this is not always a clean thing. It's not always an easy thing or the right thing, but we try to find a balance there. And so where do we go from here? Our approach will be measured. You may see the city of Hattiesburg take a step. And again, we're kind of keeping an eye on the White House's own criteria for when you move forward. So we may take a step like we're going to take tomorrow, and we may see how that measures out in terms of trying to look for a spike in infection rates over the next 2 or 3 weeks before we take the next step. All of those are designed to try and hold down the spread of the community transmission that may happen when you start putting people around each other. Trade-offs will occur. I mean, we were able to, obviously, we didn't hit the numbers that people originally projected, and that's a good thing. That was the point of all of this. Whether it was the social distancing or the governor's shelter-in-place order, or everyone staying at home, and that was the point of doing all that. And so now that we're starting to get out and amongst each other, COVID is still there. So what are those trade-offs that we can still get out there and open the economy up while still protecting ourselves and reducing the risk of community transmission? We must be flexible. This is obviously inconvenient for a lot of people, and it's hit a lot of people hard from a health standpoint, from a job and work standpoint, from a fear and mental health standpoint. And we realize that we're going to have to be flexible going forward if we're going to get through this thing together. And finally, we need to name who we are willing to risk. And sometimes on social media, and I realize that everyone can get brave behind a computer screen, but people talk about those folks like, hey, let's let the vulnerable stay at home, or they can stay inside and I can get out. But I think if we really start to put names and faces to those folks, it's a lot more personal than that. These are our parents and grandparents. These are friends and fellow church members and neighbors who may be dealing with cancer treatments or diabetes or some other chronic disease that really are at risk. And so when we classify people just as a segment of the population, we really need to kind of talk about who we are speaking of, because that sometimes will change our perspective and it'll cultivate a little bit more compassion. However, when we talk about reopening, this is going to happen tomorrow. We're starting with non-essential retail. This is the first step that we're taking in terms of reopening the city. We chose non-essential retail because Governor Reeves has already made a step on that with his executive order last week. And so these apply to your clothing stores, florists, shoe stores, furniture stores, bookstores, things like that. Anything that doesn't meet the definition of essential retail in his first executive order, 1463. Currently in the city of Hattiesburg, non-essential retail is operating by curbside, delivery, drive-through, or by appointment. Tomorrow we are going to open that up a little bit more. We're going to start allowing in-house capacity, in-store capacity for folks to, for stores to open their doors and the public can come in. We are tying this to the square footage of the sales area. And so if you are a retailer and you have a sales area between 0 and 5,000 square feet, you can have 10 or fewer customers, and it goes up every 5,000 square feet. So if you're between 5 and 10,000 square feet in your sales area, not your total area, you can have 20 or fewer customers. Between 10 and 15,000, you can have 30 customers. 15 to 20,000, 40 customers or fewer. And then finally, anything above 20,000 square feet in sales area, you can have 50 or fewer customers. And that's going to be the cap, is the 50. Of course, we are requiring that all non-essential retailers abide by appropriate social distancing around checkout, around entrances, or in other areas, to try and, again, keep people spread out, keep people from coming into contact with each other. But there is a trade-off. By starting to open up the economy, we're going to have to engage in some behaviors that can hopefully reduce the risk of community transmission. And that's going to be masked inside all retail areas. Of course, Hattiesburg was the first city in the state to require employees to wear masks several weeks ago. And since then, we've seen more than half the population, when I go into a grocery store, are having these on. But now we're going to say that customers that are 10 or over have to wear masks when they go inside retail areas. So there'll be some requirements that still continue from the Executive Order 2020-4. Employees, of course, if you're in the same workspace as other employees, or if you're in the same room as the public, you'll have to wear masks. But in this executive order, we also add customers that are ages 6 and above to wear masks at all retail locations. This does not include you walking your dog or in the parking lot. But when you go into the store, you need to mask up. Of course, people ask, what is a mask? It's any face covering that includes a linen or cloth mask, a dust mask, a handkerchief, bandana, or something more sophisticated like a surgical mask or an N95. But essentially, it's anything that can cover your nose and mouth and still allow you to breathe comfortably. Masks allow us to move forward in this process while still protecting each other. This is not about just setting more rules. This is about how do we responsibly take steps together to reopen our economy. And the trade-off is that we wear masks. Again, the reason that we were able to hold down the infection rate to something far less than what was projected It's because we engage in things like social distancing and shelter in place. Well, we know we can't keep the shelter in place going forever, and as we get out into the community, we start getting around each other again, when COVID is still very present, masks will reduce the risk that we are going to see spikes in infection rates. And so that's what this is about. And folks have asked us, well, how are you going to enforce this? Look, this all comes down to personal responsibility and common sense. Yes, we are encouraging businesses to enforce this when at their entrances. We're asking them to post this, but we're also appealing to just your good common sense. Will our fire department make spot checks and follow up on complaints when folks aren't wearing masks in high numbers? Of course. Are we going to turn this into a police state where we're hiding behind every clothes rack and potted plant and cash register? No, we're not going to do that. But are we appealing to your sense of decency and your sense of personal responsibility and your love of neighbor and just doing the right thing to protect each other? Yes, we are appealing to that, and we hope that you will join us in that. Aside from non-essential retail and masks, the other same things from previous executive orders that are still under Governor Reeves' safer at home order continue. Due to his order, to-go and delivery are only options for restaurants right now. Bars, barbers, salons, gatherings limited to 10 or fewer, nail salons, spas, massage parlors, those are all still closed. However, what we are working on is we're having lots of different stakeholder conversations about how do we reopen things like gyms and barbershops and salons and churches safely. We've had 3 groups of pastors meet this week about what are some good timelines and guidelines for when congregations can start meeting safely again with some guidelines. And so those are going to continue. So if and when the governor relaxes his executive order, that we hope to have plans in place and timelines that you can look to, again, to continue to reopen Hattiesburg in a very steady, measured, and safe manner. Our act of courage tonight, we want to definitely spotlight the folks at Merit Health Wesley. They had a patient today who had spent several weeks in the hospital with COVID, and she was able to leave today. Merit Health Wesley's had several great stories, as has Forest General, folks being on the ventilator for a week or two and then coming out and recovering. And I want to thank the staff at Merit Health Wesley for all that they've done. They're now ICU free in terms of COVID-positive patients. I want to thank all our healthcare providers, including Forest General. So as we go into Friday and into the weekend, I encourage you really just wash your hands, take care of yourself, wear a mask if you go out in public, do only what is essential, and stay home. And courage.